First, I want to hide those incisions in a convenient location. That's where the bikini will lie. So I mark that out before we start the surgery. It sounds simple, but it's not, because we have tissue moving so much in different vectors in different parts of the body. It's an important challenge, and it starts with the markings. The second important principle is to use meticulous technique in the closure. This involves hundreds of internal sutures that are able to lift and take tension off of the wound and distribute it along the entire surface area of the surgical incisions in a way that will minimize the tension on the skin and obtain the best scars possible. And lastly, we are very diligent about post-operative care. Even when the patient is healed a couple of months following surgery, we are not saying goodbye to that patient. We want them to come back, and we want to work on those scars until they are as thin and flat and nice as possible. So what do the scars actually look like? Of course, everyone wants to know, and here are many examples. When you use the best techniques, we tend to get very beautiful scars. It's important to note, however, there is a lot of genetic variability, and it's not always the case. Tummy tuck scar. This is an ultra close-up view over 1 year following a body lift operation. Here you can see the hair follicles at such a close-up. Obviously, there's nothing to be embarrassed about. You can see here that the underwear elastic markings are actually more significant than the scars in some locations. That's an ideal situation to be in. I'm adjusting the position of the red underwear in this patient to show you a beautifully healing wound. This is less than 3 weeks following surgery. I just removed the Steri-Strip tape from the wound. It's barely a scar, but look how beautiful it is already and how nicely positioned it is. This patient is approximately 3 months following surgery, and she just underwent fractional carbon dioxide laser treatment of her scar. That's why it's a little bit red and a little bit wider than these other incisions. That incision also is going to fade beautifully over the next 6 months. Positioning the scar underneath where the desired bathing suit or underwear position is totally key. And it's difficult to achieve. But after doing so many hundreds of these procedures, I feel like we've got it down. This case in a darker skinned patient illustrates how beautiful a scar can appear even in a patient with additional pigment. The Bikini Body Lift is a revolutionary procedure. It has transformed our ability to improve the appearance of the buttocks and thighs. For more information, you've got to check out our website, drstoker.com. We've got over 12,000 beautiful before and after pictures and videos to match.